When the clear part of our eye, that is cornea, which is usually a dome sepid, becomes somewhat conical sepid, this disease is called keratoconus. Hi, I am Dr. Suryakant Jha, consultant ophthalmologist at eternavisionandaesthetics, Shivalik, New Delhi. And today, in this video, we will be discussing about the keratoconus in details. Keratoconus. The cause of this disease is largely unknown, but it is genetically connected and it is present in around 10% population of keratoconus patients. In India, the incidence is usually higher than the world's population and it is present in around 2% of total population. Coming to the risk factor, as we have discussed, it is genetically connected. In any person having family history of keratoconus, they should get themselves evaluated and should follow up regularly. It is present in patients with allergic conjunctivitis as they frequently and profusely rub their eyes, and this continuous rubbing can lead to advancement of the keratoconus disease. Keratoconus can be associated with other disease such as retinitis pigmentosa, Down syndrome or asthma patients. Now coming to the symptoms, how do patients present to the doctor? Due to the shape of the cornea, they can experience distorted or blurry vision, or they can sometimes experience glare or light sensitivity. When they present to the doctor will do the refraction. In keratoconus, the refractive changes are very frequent, and in every 3 to 6 months there are changes in the glasses prescription, usually the cylindrical power. It is usually presented in early teens and usually progresses to the late 20s. If keratoconus is detected in the late 30s, it is usually non-progressive. Coming to the diagnosis. Diagnosis is generally clinical and it is supported and confirmed by corneal topography or pentacam scan. Doctor will check your refraction, do the keratometry to see the corneal curvatures and do the slit lamp examination. Corneal topography or pentacam is very effective and can detect keratoconus. Signs of keratoconus are seen in slit lamp. Now coming to the treatment of this disease. Treatment mainly depends on the severity and progression of keratoconus. If the disease is progressive, our first aim is to halt the progression. This is done by a procedure called collagen cross-linking, or we call it C3R or CXL. In this procedure, we use a dye called riboflavin and UV rays strengthen the cornea and halt the progression or slow the progression. It's very effective in slowing the progression of keratoconus, and retreatment is rarely required. C3R does not reverse the damage that has been caused by keratoconus and do not increase the vision. To increase the vision, we may use a spectacle and contact lenses in mild to moderate cases. These contact lenses can be hard contact lenses, scleral contact lenses, or customized contact lenses made according to the shape of the patient cornea. Another procedure called intacs or intrastromal corneal rings are used. In this, semicircular rings are inserted inside the cornea, which stretches the cornea and somewhat improves the vision. To further improve the vision, we can give them spectacles or contact lenses, or in higher number, we can opt for ICL. Thank you. I think I have discussed keratoconus in details. If you have any further queries, you can write to us in the comment section. We will be happy to answer them all. And to see more videos like this, you can subscribe to our channel. Thank you.